Hi, welcome to Rope In Mental Health. I'm Garrett Kennedy, mental health consultant. I want to talk to you today about building resiliency while you're managing crisis. Crisis management systems generally have three goals: to return the sense of control to the person or situation who's in crisis, to minimize the loss and impact to that person or situation, and to prepare for a faster, quicker, better response next time. The first step in doing so is building a resilient plan in the first place. To build a resilient plan, you have to know what's normal, because that's what you're going to measure. So when you're writing your policies, procedures, setting out the work tasks for the day, whatever scope it is that you're doing, even if it's just telling children to do chores or homework, you want to set out the tasks in a meaningful way that the child understands what is expected. That's to say, when you're building your plan of action, before the crisis happens, plan for success. Plan for that green zone moment, because we're going to be constantly looking for and measuring aspects towards the actual physical productivity and behaviors, make sure that they're beneficial, positive to the system. We're going to be looking at the intent of actions and make sure that everybody's still on board with that end goal. Make sure that we actually understand that each worker in the situation knows their part, knows their place, and is educated and competent to do their part. We want to keep things in a positive light and focus really on that success. Focus on assessments being a needed part to see where we are in the measurement, and assessments themselves will become a positive reinforcement tool. Just like in school, as children are given out assignments and whatnot, and they expect certain letter grades, the expectation is that we build a positive reward system into that. So that when we're looking at a crisis management system, when we set people up with a job and a task, make it very clear what their expected behaviors are, what the intent of this process is, and how we can actually attest to the motivation to continue of the situation. So motivation can be a tricky part that we can get ahead of right away at the planning. Motivational changes can happen for many different situations. Lots of that can be sidestepped or simply avoided by providing accurate and up-to-date feedback on how somebody's doing. Make them feel their tasks are meaningful and they will continue to do more tasks. This is the importance of having a well laid out plan. While you're maintaining this system, you're going to want to look at what do we actually measure, which brings us step 2. Step 2 is observation. It's observing what's going on. Know what is the normal. Knowing what's normal is going to mean figuring out exactly for your situation, how do we measure positive behaviors and positive productivity. As long as things are moving towards that end goal, things are good. We're making enough widgets, whatever it happens to be. We also want to look at the knowledge of each employee. We want to make sure that they're competent. And competent of team members who are competent, know their place, know their duties, and are educated or trained to actually do those tasks effectively. Next, we're going to look at the actual attitude of the situation. We're going to have to find a way to measure and monitor what is the general attitude and feel of the people or team members who are involved with this process. Is their attitude one of confidence and success? If it's not one of confidence and success, we want to evaluate what's going wrong and respond to that appropriately. The next thing we want to measure in our observation phase is the overall environment, the spiritual health of your organization, that good old rah-rah college spirit, try kind of spirit. We want to look and make sure that everybody is on board with the plan, everybody understands what the end goal is, and everybody understands in this crisis that the goal for this crisis is to return things back to normal or discover a new normal that works in a positive way for everybody. So after we're doing the observations, we want to move on to kind of step 3. It's that positive action step. there's a bit of communication that's needed there. And why I'm hesitating is because part of the observations are the active step of communicating. We have to make sure in step 3, where we're looking at positive actions, that we describe all of those procedures, all of any procedures that we're talking about, be they communicating observations or actions that should be taken to reduce the crisis situation. They should be clearly written in words that workers already understand. When people are moving and you're observing that change from what I consider green zone being productive in purpose, productive in action, productive in intent, and then productive in heart. If you're productive or green zone, you want to recognize that and celebrate it. It provides that positive reward system, as we mentioned. But when things start going awry and things start elevating into more yellow zone, which would be anxious, confusion, maybe even a little bored, people can quickly fall off the path of the plan. So when we're observing these things, we want to observe in a positive way that lets people know this is not Big Brother looking over your shoulder, waiting for areas that you're going to screw up in. That's the wrong way to go through an assessment. An assessment should be a positive situation, including and especially in a crisis. While you're managing crisis, you have to keep things in a positive, we're working towards an end mentality. The end of the goal is to return back to the green zone, understanding that green zone may change. So we have to make sure that in the planning stage or in the positive action stage of crisis response, that actions we're doling out are meaningful, measurable, and that the people conducting them understand how they're being assessed so that they know instantly and they can grow that self-assessment skills to keep themselves in the green zone and keep themselves going towards that intended goal. And in a crisis, that's to return everything back to normal. So finally, in the last step of this situation, we're looking at environment maintenance. We're looking at taking all that information we've been observing through this process, looking at how did we respond to the actual crisis and what was the outcome. Did we like that outcome, or should we plan for a different outcome in the next time it's in crisis, something's in crisis? Looking at, say, behavioral changes for safety at work. I was working on mental health wards commonly, and sometimes there'd be behavioral changes that need to happen as far as, say, violent tendencies. Well, when we responded to a situation of crisis that resulted in possible physical danger, we looked at implementing known calming methods, kind of like the Hulk. If you want to see a great example of crisis management, watch The Avengers. When we're looking at how the Hulk is dealt with, we're told whatever Avenger is his friend walks up to him and reminds him, this is the time you need your calming skills. The sun is going down, things are getting calm, and they go through what is effectively a triggering word for Hulk to use his own self-regulating methods to return to Dr. Banner. So I suppose, just before I get any messages down below from comic book fans, it would be a trigger to get through to Dr. Banner. You get the idea. So when we're looking at a system of crisis management in real life, what we want to do is make sure that we compare the outcome we actually achieved with the outcome we wanted. And if that aligns, or if that needs to change, we need to address that immediately after the crisis. When everything returns back to green zone, that's when people are in the best situation to learn. Immediate reflection upon a crisis that just happened and continual debriefing throughout will help maintain a motivated, positive presence, because the environment will be known to be supportive, attuned to the actual changes that happen, and quick to respond when help is called for. These are the general things that we're looking for in this system. I hope you guys are finding these videos very helpful. The next thing I think I might tackle is actually looking at the ROPE-IN acronym I've been using again, because it does stand for having a resilient, observant, positive environment. Crisis management systems exemplify this model as a resiliency building tool in and of itself. We want to manage crisis in a way that is very transparent, that has frequent assessments of progress, so that we can adjust behaviors along the way to more efficiently get to our end goal. A crisis should not be something to be avoided, but it should be looked at as an opportunity to implement a crisis management system which will gain needed, valuable data so that we can avoid what happened to cause this crisis in the future, so that we can look at a faster, more reasonable, more efficient response from the network that is created by being roped into mental health, to be supported by that safety net and catch us when we fall and don't even notice it ourselves, because the constant assessments should be done in a way that reassure me that I'm being monitored by a caring and nurturing supportive system that's going to guide me back to the original goal when I get derailed. This is how we can aim to manage crisis in a very resiliency building method, and hopefully return to our green zone as fast as possible, enjoy our day, and maybe even work out a few procedures that work better in the future. Crisis can often lead to innovation. I hope you guys have enjoyed my chat today. Thank you very much for tuning in and listening. I hope you guys spread the calm. I hope you stay safe. Remember, stay indoors while the health ministries tell you to, and find yourselves a way to exercise and keep things positive.